Hello. Today we're diving into an important but sometimes lesser known medication, Clozapine. Whether you're dealing with treatment-resistant schizophrenia or know someone who is, Clozapine could be a game changer. But it's a medication that comes with significant precautions. So let's break it all down. What it's used for, side effects, and why it requires such special monitoring. Let's get into it. Clozapine is an atypical antipsychotic, meaning it works differently from the older typical antipsychotics. While medications in this class are often used to treat schizophrenia, Clozapine has a very specific role. It's primarily used for treatment-resistant schizophrenia. Now, you might be wondering, what exactly does treatment-resistant mean? Well, treatment-resistant schizophrenia refers to cases where other antipsychotic medications haven't worked well enough, or the side effects of those other meds were intolerable. In fact, around 30% of people with schizophrenia fall into this category, where standard medications just don't do the trick. That's where Clozapine steps in. It's often considered the last resort when other treatments have failed. Schizophrenia itself is a serious, lifelong mental health condition. It affects how a person thinks, feels, and behaves. People with schizophrenia often experience delusions or false beliefs that don't align with reality, hallucinations, such as hearing or seeing things that aren't there, disorganized thinking, where their thoughts don't follow a clear pattern, cognitive challenges, like trouble concentrating or remembering things. These symptoms can make everyday life extremely difficult, affecting relationships, work, and overall quality of life. But here's another crucial point. Clozapine isn't just for controlling the main symptoms of schizophrenia. One of the most important things about Clozapine is its ability to reduce suicidal behaviors. People with schizophrenia and schizoaffective disorder are at a higher risk for suicide compared to the general population. And Clozapine is the only antipsychotic with proven efficacy in lowering this risk. That's huge. No other antipsychotic has shown to be as effective in this area. But, and this is a big but, Clozapine isn't the first choice for treatment. Why? Because it comes with significant side effects and requires close monitoring. I'll get into the details of those in a bit, but let's just say Clozapine isn't something your doctor prescribes lightly. It's a powerful tool, but it comes with responsibilities for both the patient and the healthcare provider. So, how does Clozapine work? Like other antipsychotics, it targets brain chemicals, specifically dopamine and serotonin receptors. What makes Clozapine unique is that it seems to balance these chemicals in a way that's particularly effective for people who don't respond to other treatments. This can help with reducing hallucinations and stabilizing mood, but it also helps with emotional flatness and cognitive symptoms, making it a more well-rounded treatment for schizophrenia. Now let's talk about side effects, because this is where Clozapine gets tricky. Like any medication, Clozapine has a range of potential side effects, and some of these can be more serious than others. Let's start with the more common ones, and then we'll get into the big risks that require extra caution. The most common side effects of Clozapine include drowsiness or sedation. Clozapine is known to make people feel very sleepy or drowsy, especially when they first start taking it. It can even cause daytime grogginess, which can affect your ability to drive, work, or focus on everyday tasks. Over time, this sedating effect might lessen, but it's something to be aware of, especially in the early days of treatment. Weight gain. This is a common issue with many antipsychotics, but it's particularly significant with clozapine. Weight gain can lead to other health problems like diabetes and high cholesterol, which is why your healthcare provider will monitor not just your weight, but also your blood sugar and lipid levels. Maintaining a healthy diet and getting regular exercise can help mitigate this, but it can still be a challenge for many patients. Constipation. This is actually one of the more concerning side effects of clozapine. While constipation might sound minor, with clozapine, it can become severe, sometimes leading to serious complications like bowel obstruction. In fact, some experts argue that constipation with clozapine is under-recognized, but can even be life-threatening if not managed properly. You'll want to stay hydrated, increase fiber uptake, and use laxatives if necessary to keep things moving. Dizziness. Many people experience dizziness or lightheadedness, especially when standing up quickly. This is often due to orthostatic hypotension, where your blood pressure drops when you change positions. For this reason, it's important to stand up slowly and be cautious when moving around, especially in the first few weeks of treatment. Increased heart rate. Clozapine can cause tachycardia, which means your heart rate speeds up. For most people, this is a mild increase, but if you notice any chest pain, shortness of breath, or irregular heartbeats, you should contact your doctor immediately. Excessive salivation. This one is a bit unusual but common with clozapine. Hypersalivation, or excessive drooling, especially at night. While it's not dangerous, it can be uncomfortable or embarrassing. Some people use a towel on their pillow or take medications to help reduce the amount of saliva produced. Now, these side effects can be unpleasant, but generally manageable with the right precautions and treatments. However, there's one major risk that sets clozapine apart from other antipsychotics, and that's agranulocytosis. This is a fancy medical term for a dangerous drop in white blood cells, specifically neutrophils, which are essential for fighting off infections. If your white blood cell count drops too low, your body's ability to fight infections is severely compromised. This makes you more vulnerable to things like pneumonia, sepsis, and other serious infections. And here's the thing. Agranulocytosis can happen suddenly, often without warning. That's why, if you're taking clozapine, regular blood tests are non-negotiable. In the first few months of treatment, you'll need blood tests every week to monitor your white blood cell count. After 6 months, if your levels have been stable, you can move to bi-weekly testing, and eventually, after a year, it may be reduced to monthly. But you can't skip these tests, because catching agranulocytosis early is the key to preventing serious infections. If your white blood cell count drops too low, your doctor will immediately stop clozapine, and you may need treatment to help boost your immune system. Now, this sounds scary, and it is, but remember, with close monitoring, the risk of developing agranulocytosis is reduced significantly. The monitoring system in place ensures that this rare but serious side effect is caught early, and for many people, the benefits of clozapine outweigh this risk. In addition to agranulocytosis, there are a few other serious side effects you should be aware of. Myocarditis. This is inflammation of the heart muscle, and while it's rare, it can be life-threatening. Symptoms include chest pain, shortness of breath, and a fast heartbeat. If you experience any of these, seek medical help right away. Seizures. Clozapine can lower the seizure threshold, especially at higher doses. If you have a history of seizures, your doctor will monitor you closely or may adjust your dose to minimize this risk. Metabolic changes. Along with weight gain, clozapine can increase your risk of developing diabetes and high cholesterol. Your healthcare team will monitor your blood sugar and cholesterol levels regularly to catch any early signs of metabolic issues. Fever and flu-like symptoms. Sometimes fever can be a sign of infection or even the early stages of agranulocytosis. However, fever can also occur as a result of a side effect called benign hyperthermia. If you develop a fever while taking clozapine, it's important to notify your healthcare provider immediately to determine the cause. So, while clozapine can be a highly effective treatment for people with treatment-resistant schizophrenia, it's not without its challenges. The key is regular monitoring and being aware of these potential side effects. With the right precautions, many people find that the benefits of clozapine, like improving quality of life and reducing symptoms of schizophrenia, far outweigh the risks. Given clozapine's side effect profile, it's not for everyone. Here are some special considerations to keep in mind. As I mentioned, agranulocytosis is a serious risk, so you'll need frequent blood tests, weekly for the first 6 months, then less frequently if your levels are stable. Clozapine can cause a fast heart rate, high blood pressure, and even myocarditis, an inflammation of the heart muscle. So if you have any heart conditions, your doctor will need to closely monitor you. At higher doses, clozapine can increase the risk of seizures, especially if you have a history of epilepsy or other seizure disorders. Here's a fascinating fact. If you smoke, it can affect how your body processes clozapine. Smoking increases the metabolism of clozapine, meaning you might need a higher dose if you're a smoker. But if you quit, your dose may need to be lowered to avoid toxicity. Now, constipation might seem like a minor issue, but with clozapine, it can be severe and even dangerous. It's important to stay on top of this by using laxatives if needed and staying hydrated. So you might be wondering, is it worth it? For people with treatment-resistant schizophrenia, clozapine can be life-changing. In fact, it's often called the gold standard for this condition. Research has shown that around 30 to 60% of people who didn't respond to other antipsychotics do respond to clozapine. That's pretty impressive when you think about it. It can help reduce symptoms, lower the risk of hospitalization, and improve overall quality of life. And remember, it's the only antipsychotic proven to reduce the risk of suicide in people with schizophrenia. If you or a loved one are struggling with schizophrenia that hasn't responded to other medications, clozapine could be a good option. But it's not a decision to take lightly, given the need for close monitoring and the potential side effects. Make sure you have a strong relationship with your healthcare team and keep up with all of your appointments for blood work and heart monitoring. It may seem like a lot, but for the right person, clozapine can be a transformative treatment. Have any questions about clozapine? Drop them in the comments below, and I'll do my best to answer them. Thanks for tuning in to today's video. If you found this helpful, don't forget to hit that like button. And if you're new here, subscribe for more tips and insights into living a happy, healthy life. Until next time, I'm Pharmacist Michael, and I'll see you in the next video.